Hi, Dr. Garima here. Uh, how's the weather here in Dubai? Wow. So, what I really hated in Mumbai was the rains because rains by itself is beautiful. But when it's to rain in Mumbai, because of the extreme level of constructions, haphazard, unplanned city that it has become, there used to be waterlogging all the time, impossible to go through anywhere. And if you have some necessary work to be done, gone, it's gone, and then you'll be stressed out, or even if you manage to reach somewhere, so much of traffic. And today the same thing is happening in Dubai. No, Dubai has very good level of construction and very well planned city, but they what they don't have, I think, is a proper drainage system. And I think the rains, or rather, it's a storm out here. The whole day, I haven't been able to see the sun. There was no sun. It was just dark clouds. Even at 2 o'clock, it was as if a dark night. Very gloomy. I cancelled all my patients and rescheduled because there was so much of waterlogging below my building and near my clinic and almost everywhere in Dubai. The metro trains dropped. I hope tomorrow it's a better day. So, since I canceled my patients, I was like, what to do? I cooked up something nice. I've posted that on Instagram. But, anyways, I thought today is the day that I have an off now. Let's shoot another video. So, coming to it, today's topic of discussion would be asthma and dental caries. Uh, take a pen and paper always when I'm you're watching one of my videos on the SBQs of the exam. Please make notes for you to refer to them later. Speaking of notes, my birthday gift arrived, which I gifted myself. Remarkable. I have such a organized kida in my brain that this is just the thing that I want, and I love to write and love to store, and this is just the thing that I was looking for. Surprisingly, I wasn't even aware that this was launched in 2020. I don't know, like so outdated. I think COVID happened, my son happened, Australian exam happened. I think I was outdated with technology. And then when I saw this with my clinic manager like few months ago, I'm like, what is this? And I need to get it. So yeah, I ordered it, I researched about it, and finally I have it, and I'm very happy that I have it already on it. So yeah, so I was just writing notes on it that what to discuss to you all, and it was nice. Anyways, so let's start. Before I actually read out the question, I want you all to have a gist of the theory so that you're not confused as to why I'm choosing a particular answer. I know we all know what asthma is. We all know that people who have severe asthmas or any asthmatic attack, they take inhalers. Now, let's learn a bit more about it. See, nowadays, the recent inhalers that have come out in the market are usually dry powder inhalers. Now, this is an amazing article on asthma and dental erosion, which you can find by yourself on researchgate.net, or all my enrolled candidates. I've already downloaded this and uploaded in the Google Drive in the charts and guidelines folder where you can go and refer to it. Beautiful article. You should read this article. But I'm reading the important part of it right now. So nowadays, the inhalers that are available are having dry powder. Now, that dry powder, apparently, when you inhale, it goes into the right place. So it reduces the side effects of the medicine because it's just hitting the right spot to cure. But one of the problems with that is the moment you take it, it kind of, if you can read here, it's acidic and it reduces the oral pH less than 5.5. Now, we all know that enamel starts to dissolve if the pH of the oral cavity goes below 5.5. So, just imagine a patient with a severe case of asthma is taking the inhaler 3 to 4 times in a day, and the pH is reduced up until 30 minutes after the inhaler has been taken. So 30 minutes, like 1.5 hours, the pH is less than 5.5. It is going to lead to dissolving of the enamel. Now, although the bacteria may or may not be involved in it, it would still dissolve the enamel and may not result in caries, but it would lead to erosion. Lack of bacteria, still the enamel is dissolving, is called as erosion, right? And eroded space can lead to sensitivity because the dentine starts to get exposed. Also, a lot of patients with asthma, because of these medicines, which are mostly steroids, they result in gastritis. And gastritis again can play another role, due to the reflux, it can further complicate the asthma. So then the patient ends up taking antacid, which has another sort of side effects in the long run. So basically, if the patient is not taking an antacid, then gastritis can happen, and that can also lead to erosion. Now, when a patient comes to you who's a chronic asthmatic patient and it says that I'm having sensitivity of teeth, and when you examine, you find that there are many places where erosion has happened, and you ask the patient how, and he says, I don't know, but I take my inhaler like 3 to 4 times a day as prescribed. I inhale, I sometimes brush my teeth immediately afterwards. So then you have to know that if it's a dry powder inhaler, then he's taking something with a low pH and which results in dissolving of the enamel. And when the pH is already below 5.5 and you're further brushing the teeth, more damage. So how do you manage such scenarios? You have to counteract that acidic pH, right? So what you do is, wait, what happened here? You will ask the patient to maintain a proper oral hygiene, first of all. What you can do is you can use a basic mouth rinse such as liquid antacid, sodium bicarbonate in water, milk, or neutral sodium fluoride mouth rinses. So if you can see here, sodium bicarbonate is one of the options which is given here, which you can use to neutralize the acidic pH. You can use sodium fluoride mouth rinse and many other things which are mentioned here. Another modification of the drug delivery system, you can ask the patient to use a spacer. A spacer is basically something which will hold on the delivery of the drug, because when you have an attack or you feel like you have to inhale, you constantly keep on puffing, inhale, exhale types. A spacer will deliver the medicine after few puffs, but you will still keep on getting the air. So that's called as a spacer. You can Google or YouTube more about how a spacer is administered. You can pause this video, Google it, or YouTube it now so you understand how it works. And then you can come back and continue the video. Then, what you can also do is you can increase the salivary flow and buffering capacity. You can use sugarless chewing gums to stimulate salivary flow, and buffer the oral acid should also be encouraged. So, experimentally, chewing gum for at least 1 minute after using an inhaler neutralize the interdental plaque pH. Adult asthmatics can be advised to use salivary substitutes, sip plain water, and use daily fluoride mouth rinse to compensate for xerostomia. All age groups of asthmatics should be made aware of the problem and encouraged to have a regular dental checkup. Treatment with gastric reflux, antacids, and something else. So basically, a case report has been mentioned here in this article. The commonly used inhalers have been prescribed. And in the discussion or the conclusion part, it's concluded that the asthmatic individuals are one of the higher risk groups suffering from dental erosion. Therefore, patients with bronchial asthma should receive special prophylactic attention for the condition. So here I believe now you have more knowledge. Read the entire article and I've just read gist of it. That how asthma and basically the medications used for asthma. It's not asthma by itself causing dental caries. It's the medicines that are used for asthma reduce the salivary pH, and if you don't neutralize the salivary pH, then it would lead to erosion because enamel would start dissolving in the pH if it's less than 5.5. So various methods have been given. So this is one part that I want you to understand. The second part is, let me go here, something called as AERD or NERD. What is that? Aspirin exacerbated respiratory disease, which is commonly called a non-steroidal anti-inflammatory drug, exacerbated respiratory disease. It refers to combination of asthma, chronic rhinosinusitis with nasal polyposis, and NSAID intolerance. What I want you to remember from here is that in some patients with asthma, whenever they take aspirin, they have further increase in their sinus condition or asthmatic conditions, because somehow I have read, I think I have it here. Yeah, it appears to be an inflammatory condition that results in abnormal activation of mast cells. Now, mast cells contain histamine, and histamine causes the allergic reaction. So, if you have asthma and due to some pain you have taken aspirin, it's going to further stimulate and cause outburst of the mast cells, which would release histamine, and histamine would again cause the same symptoms what asthma has, that is bronchoconstriction, wheezing, etc. So that is called as aspirin, this thing, aspirin induced or aspirin exacerbated respiratory disease. So, if a person is on asthma, try not to give aspirin. That is what I'm trying to say. Or if a patient comes and says, I have asthma and I was having a headache or a toothache and I took an aspirin, but my asthmatic condition worsened after that, or I have these symptoms, then you have to understand that it's because of the aspirin that the patient has taken, and you can give an antihistaminic and tell the patient to avoid further usage of aspirin. Understood? And the last thing that I want you to know is to understand how a spacer works. You can read this, and again, I said pause, Google, watch a nice YouTube video. The YouTube videos are 2-3 minutes long, so I'm not incorporating here. A spacer is nothing but either it's a pipe-like or a balloon-like device which has valve only on one side. So basically, it doesn't let the medicine come through in certain puffs, and then you remove the spacer and further take the medicine. Basically, to slow down you in taking the medicine, because when you get an attack, you are breathing in and out very fast, and we don't want the medicine to be delivered in every puff. Okay, so that is the idea of the spacer. I also want you to read how much puffs can you give. I think it's max 10, but just read more about it. And how many times you should give the spacer between each puff, and write it down and revise it. Okay. Now, having said that, and having given you a bit of knowledge about asthma, which I hope has helped you, absolutely exam oriented knowledge, no extra words. Okay. Let's go to the scenario based question. A male patient, 43 years of age, came with a chief complaint of sensitivity to cold food. Sensitivity. Keyword. He also complained of discolored restorations in his upper and lower front teeth. Okay. So the fact that he already has restorations in upper and lower front teeth, you should see whether it's because of the caries or whether there was a problem which required restorations. If it was not caries, then your eyes and ears should immediately pop up as to why he needed restorations on his upper and lower teeth in the first place. Okay. The patient's medical history revealed that he is an asthmatic on medication, inhaled corticosteroid salbutamol, and an antacid omeprazole. He has been suffering from this chronic is long standing, okay? Acute is less than 2 weeks, chronic is more than that. Inflammatory condition since 18 years, a long time. And his asthmatic attacks are triggered by dust. So basically, he can have the attack anytime. Dust is present everywhere. Since then, he has regularly been on medication. Now, when asked about his oral hygiene habits, it was understood that the patient brushed his teeth 2 to 3 times a day, immediately after the use of inhaler. So he is brushing regularly. And the key word here is immediately after the use of the inhaler. So just imagine salbutamol inhaled, it decreased the pH, and the patient further went and abused the condition by brushing unintentionally, of course, thereby eroding a lot of dental enamel. A clinical examination revealed a saucer-shaped loss of tooth structure. Saucer-shaped, it's a plate-shaped, a classic cervical lesion kind of a thing, basically. On the label surface of teeth 2, 3, 3, 4, 3, 5, 4, 4, and 4, 5, basically anteriors and the premolars. There were also discolored composite restorations on the label surface of 2, 2, 3, 1, 3, 2, and 3, 3. Now, why they are discolored? See, first of all, when he was inhaling, I'm sure because it's been 18 years, even they would have got cervical lesions, which he went and got composite restorations done. Now, because the erosion is being continued, they also got discolored. Minimal attrition of posterior teeth was also seen. So there's no bruxism, there's no abrasion present. So picture is just for the purpose of showing you how it is. It may not be the exact picture which is given in the exam. You cannot get the exact picture which is given in the exam. We just try and find which simulates the best scenario. But the question itself was pretty much detailed. And in the exam picture, probably they would have shown some saucer-shaped lesions with discolored restorations. Now, question number one. The most probable cause for tooth structure loss in this patient could be due to most probable cause. Poor oral hygiene? No. The keyword was the patient is brushing 2 to 3 times a day. Parafunctional habits? If they would have been present, there would have been something on the posterior teeth as well, but the question says no attrition of the posterior teeth, so I rule that out. Brushing of teeth immediately after the use of inhaler, probably. Regurgitation, not a wrong option either. C and D both are correct, but like I said, now that you know the theory, I will prioritize option C over option D. Okay, so I'll choose C. Asthmatic medication can place the patient at increased risk of dental erosion by. Now, what they are asking is what is the pathophysiology? How would asthmatic medicines cause increased risk of dental erosion? Well, reduced buffering capacity and salivary flow rate caused by beta 2 antagonist, right? Increase patient craving to consume more sports drink. Not necessarily. It does cause a feeling of xerostomia and dehydration, but then that can make the patient crave to consume liquids, not necessarily the sports drinks. Decrease patient ability to brush the teeth. Why would the motor functions of the patient be reduced to brush the teeth? So amongst the three options, I would choose A, which is more logical. Also, even if I did not know what was the right answer. So option A, since I know that is the right answer because we just discussed, but even if you did not, you can easily rule out option B and C and choose A as the remaining option of choice. I've given here some explanation. Now, what advice will you give this patient? You, as a dental clinician, the doctor of the patient, what advice are you gonna give? Stop the asthma medication before sleep time. No, you are in no position to ask him to stop any kind of medicine that he's taking. Decrease carbohydrate and sugary food consumption. Not a wrong option, but it is not valid in his scenario because you are specifically giving him advice with respect to the side effects caused by the asthmatic medication. Decrease carbohydrate and sugary food consumption is a general advice. Rinsing the mouth immediately after using the inhaler with sodium bicarbonate in water. Correct. If it would have said rinse the mouth with sodium fluoride mouth rinse, also correct. So, or it would have said take a lot of sips of water after inhaler, also correct. Use sugar-less chewing gum for at least 1 minute after inhaler, also correct. So all of these options could be correct. That's why I went on that article and read in front of you so that you know that these options can also be correct. So in your exam, if sodium bicarbonate is not mentioned and all these options are mentioned, you're okay to choose them. So yeah. Another simple measure to reduce the tooth erosion is another simple method, alternative to reduce the erosion. Stop the beta 2 adrenoreceptors. No, you're not going to ask the patient to stop anything. Avoid swallowing the medication. uh, he swallows or not, the medication has stuck to the teeth anyways, and stuck as in it has been incorporated in the saliva and it has already reduced the pH. And he will swallow the medicine. How else it's going to, clear his airway? Tell the patient to use a spacer. Yes, that we saw because using a spacer would decrease the effect of the medicine on the salivary pH to some extent, not entirely, because it would be released slowly instead of everything at once. Now, the patient told you that he experienced wheezing 3 hours after aspirin tablet. That would raise your concern that he had. So patient comes and says, I was all fine. I just had a headache or something. I ended up taking aspirin, and after that, after 3 hours of it, I had a lot of wheezing, and then probably I was okay after a few hours. So you have to think why that happened. Because if you were to prescribe aspirin or any other NSAID, you would be like, okay, probably I should not, because he may be having what? AERD, that is aspirin exacerbated respiratory disease, which we just learned, right? So that would raise my concern that he had non-steroidal anti-inflammatory exacerbated respiratory disease. Now, this is kind of a right answer. Analgesic exacerbated respiratory disease, not on analgesics will cause this. We have not read anything like that. Aspirin exacerbated respiratory disease. Now, see, option A and C both are correct. Okay. But option A, because it's mentioned here, aspirin related, and the question also says aspirin, I will choose that. If A was not given, some other option was given, and option C was given, then I would have chosen that. So C is not wrong, but I would prefer A over C. Okay. So that's it. That's the SBQ for today. Hopefully, we shoot another one tomorrow, and have a nice day. And please leave in comments if you have understood everything and did your knowledge about asthma medicines increase. Well, I was happy with this question. It made me read a nice article, and I feel I'm better equipped now with this knowledge, and hope you are also in a position to administer the right kind of advice when it comes to questions like this or scenarios in your own clinic. So, yeah, leave in comments. You know, I love your comments, and especially nice comments, which I take a screenshot and then post on Instagram. I do devote a considerable time on you, all right? You should also take some time and talk to me. Anyways, have a nice day. Good night. Bye bye.